Welcome, my name is Peter Strong. I provide Skype counseling online for anxiety and depression and other common psychological problems that don't require medical treatment but really require you learning better ways of working with your emotions. As an online therapist, I have been specializing in offering mindfulness therapy for the treatment of anxiety and depression. And this approach does not use medications, it does not recommend medications, but rather focuses on teaching you practical and effective mindfulness-based methods for working with your emotions more effectively. The biggest problem that I come across is what I call the problem of reactive identification. This is where we simply become overwhelmed by emotional and cognitive reactions. Certain triggers may happen. It could be external, something happens externally, someone says something to us externally, or it could be internal in the form of repeating thoughts and beliefs and memories that we have that seem to come back over and over again. And these are simply triggers, whether they're external or internal. They are triggers that trigger these emotional habits, if you like, that create anxiety and depression. And it's an automatic process. It's a process that's become habitual and operates without consciousness. So the most important way to overcome emotional reactive habits like this is simply to develop more consciousness around them. And that's the first basis, if you like, of mindfulness therapy. If you really want to break free from anxiety and depression and also addiction, and if you really want to heal from post-traumatic stress or from difficult traumatic memories from childhood, then you have to change the way that you relate to these events, these triggers, so that they do not trigger more emotional reactivity that feeds your anxiety or depression. So we do this by developing mindfulness skills, including meditation, where we actually meditate on our emotions in order to build a non-reactive relationship with them. When you can sit with your anxiety, you will create the right conditions in which it will begin to heal, rather than feeding it with more unconscious habitual reactivity. If you can sit with your depression, it will heal. If you sit with emotional trauma, it will heal. The key here is to learn how to sit with emotions and not react. The same goes for the reactive thoughts themselves that feed your anxiety or depression or trauma. If they operate habitually out of consciousness, they will simply feed the underlying emotional suffering in the same way that fuel feeds fire. It simply feeds that underlying emotion, and that prevents it from healing. So when we have reactive thoughts or intrusive thoughts, we need to learn how to hold them in mindful consciousness without becoming identified with them either. So we again counter this habit of reactive identification with thoughts as well as with emotions. We learn to sit with our thoughts and not become identified with them, not to allow them to proliferate more reactive thoughts. And this is central to recovery. When you can sit with the content of mind in whatever form that is, whether it's thoughts, emotions, perceptions, beliefs, or memories, when you can sit with these contents of mind without becoming reactive, then you stop feeding the emotional reactions underneath and you promote healing. This is a very important principle, probably the most important principle you will ever learn in any kind of psychotherapy that you follow. It's much more important than trying to understand your emotional reactivity. It's much more important than just trying to manage or tolerate emotional reactivity. It's a process in which we are actually promoting the healing of your emotional suffering that we're interested in. And that's what I will teach you during mindfulness therapy sessions. So that is the style of counseling that I provide via Skype. It's a mindfulness-based counseling that will teach you how to work with your emotions more effectively. Is Skype counseling as effective as meeting a therapist in person? Yes, it is, as long as you use Skype or similar video platforms so you can see each other. That's the key thing here. You must be able to see each other so that you can communicate effectively. And this is very important. Skype counseling can actually be more effective than conventional office-based counseling sessions because you can direct the process yourself from the comfort of your own home, and that can greatly increase the effectiveness of counseling or psychotherapy. You feel more at ease, you feel more comfortable, you feel more in charge, and that's what we need, because good psychotherapy and counseling is about giving you the tools to heal your emotional suffering. It's not about treatment. Treatment will not give you the tools to manage your mind more effectively. That's why I do not advocate medications, not as a long-term strategy, perhaps for a short term to reduce symptoms. Medications can be useful, they have their place, but medications can never help you change the underlying psychological habits that create anxiety or depression. This has to be done psychologically by actually working on those habits directly. So mindfulness therapy is a very good way of doing this. If you'd like to learn more about Skype counseling using mindfulness, do please go to my website and learn more about the counseling services that I offer, and contact me. Simply email me. You can ask any questions that you may have about whether Skype counseling and the mindfulness therapy approach is right for you. I'll be happy to explain to you how mindfulness therapy can help you overcome your anxiety or depression or addiction. The other thing that I encourage people to do is to really monitor how well you progress during Skype counseling sessions. So it is not meant to be open-ended. You should see changes within 3 to 4 sessions, not 3 to 4 months or years. That style of counseling is not something I encourage. The sessions are not just there for you to talk about your emotional problems. Again, that may provide a temporary relief, but it will not help you change the underlying habits that are causing your anxiety or depression. So during the sessions that I offer, we focus very directly on the actual underlying habits that are working to create your anxiety or depression or compulsion in the case of addiction. Most people do see quite dramatic changes when they start applying the mindfulness techniques that I teach. This style of counseling is very, very effective for anxiety, and as I say, people generally start seeing huge improvements after the first 3 or 4 sessions. And even in the first session, where I will teach you some of the practical methods that you can practice yourself between sessions, even after that first session, you can expect to see some significant improvements. So if you'd like to learn more about online Skype counseling and using mindfulness, then please contact me and let's set up a session. Thank you.